Hello, we're here to help you through your journey of heart failure with New Jersey Cardiology Associates. We've designed a program to keep you well, to explain what heart failure is, what the symptoms of heart failure are, and what to do if you get sick. We'd like to review the symptoms of heart failure that indicate you're getting sicker, and then the steps to get you help and prevent you from having to go to the hospital. The most important thing to remember is to weigh yourself on the same scale with the same amount of clothing every morning. This is the best way to tell if you're going into heart failure. Also, it is very important to take your prescribed medications. Heart failure means the heart isn't pumping as well as it should be. Congestive heart failure is a type of heart failure that results in the slowing of blood flow in and out of the heart, which causes congestion in the body's tissues. Often, swelling or edema is the result. Most often, there's swelling in the legs and ankles, but it can happen in other parts of the body too. Sometimes, fluid collects in the lungs and interferes with breathing, causing shortness of breath, especially when a person is lying down. Heart failure also affects the kidney's ability to dispose of sodium, or salt in water. This retained water also increases swelling in the body's tissues. With heart failure, the weakened heart can't supply the cells with enough blood. This results in fatigue and shortness of breath, and some people experience bouts of coughing. Everyday activities such as walking, climbing stairs, or carrying groceries can become very difficult. Systolic heart failure, or HFrEF, is when the heart is weakened by a heart attack, heart disease, high blood pressure, valvular disease, excessive alcohol, a virus, or medications such as chemotherapeutic medications. Diastolic heart failure, or HFpEF, is when the heart is stiffened and can be the result of diabetes, obesity, COPD, sleep apnea, high blood pressure, or kidney problems. Some symptoms of heart failure include increased swelling of the legs or abdomen, shortness of breath made worse when lying down, increased shortness of breath on exertion, or a rapid weight gain, potentially of around 2 to 3 pounds in a single day. Take your medications regularly. Do not stop your medications without speaking to your provider or nurse. Your medication improves the squeeze of your heart and keeps the fluid out of your lungs. There are several types of medication you may be on. Diuretics help keep the fluid out of your lungs. You usually take them in the morning so they don't keep you up at night. However, if you have errands to do first thing in the morning, you can take them when you return home and have access to the bathroom. Beta blockers make the heart beat slower and stronger. They also reduce your risk of having an abnormal rhythm. ACE inhibitors lower blood pressure and improve the function of the heart. The most common side effect is a nagging dry cough. If you have this, please speak to your provider. ARBs, or angiotensin receptor blockers, also work similar to ACE inhibitors. Several other drugs can make your heart stronger as well. You also need to follow a low sodium or low salt diet. You can take these steps to follow a low salt diet. Stop adding salt to your food. 1 teaspoon of salt equals 2,300 milligrams of sodium, which is more than your daily intake of sodium should be. Adapt your preferred food to low sodium versions. Pick foods that are naturally low in sodium, including fruits, vegetables, fresh fish, meat, and poultry. Avoid processed foods like hot dogs, cold cuts, takeout, and microwavable dinners. Learn how to read food labels. When reading the nutrition facts, note the serving size, calories, sodium, and carbohydrates. Most people eat significantly more sodium than they need. This can cause congestion in your lungs because you are unable to get rid of the fluid and salt due to your heart being weakened. Choose fresh food instead of processed food when you can. Use the nutrition facts label to check the amount of sodium. Look for foods with 5% of your daily value for sodium. A sodium content of 20% DV or more is high. Look for foods labeled low sodium, reduced sodium, or no salt added. Take the following list with you next time you go food shopping. Get plenty of vegetables and fruits. This includes fresh, frozen, canned, and dried fruits and vegetables. Be sure that these products are packed in water or 100% juice, not syrup, and are low sodium or have no salt added. By washing canned veggies, you can reduce the salt content by 50%. For breads, cereals, and grains, compare labels to find products with less sodium. When you cook rice or pasta, don't add salt. If your food comes with a seasoning packet, use only part of the packet. This will lower the amount of sodium in the food. Choose fresh meats when possible. Some fresh meat has added sodium, so always check the label. Choose fat-free or low-fat milk and yogurt. Be sure to check the label on cheese, which can be high in sodium. When you cook, use dressings, oils, and condiments that are low in sodium or have no sodium at all. And try these seasonings instead of salt to flavor your food. Smoking causes the blood vessels in your body, including those in your heart, to constrict or narrow. And the carbon monoxide in cigarette smoke affects the oxygen-carrying ability of your blood. Your heart has to work harder to supply your body with oxygen, making your ability to breathe more difficult. Exercise makes your heart stronger and improves the circulation in those who have heart failure. Make sure you speak to your provider before you start an exercise program or cardiac rehab. Now you have the knowledge and tools to manage your heart failure. It's important to continue your medications, maintain a low-salt diet, and be as active as possible. Remember, weighing yourself daily is the best way to determine if you're going into heart failure. If you have side effects from your medications, or problems getting or refilling your medications, please contact your care team. We're here to help, encourage, track, and assist you with your heart failure management when you need us the most. We believe we can better manage your heart failure if we work together. Thanks for watching.